We have the CEO of Nuevolution here, Alex, and this is your remote.
Okay, thank you so
please
much.
give our presentation, and you have the clock there. Thank you.
So time is running. Do I need to do anything to?
I think it's
okay.
So
good.
When it's 0, I will come back to you.
So good morning. I'm a Dane. I could speak Danish to you. I'm not sure you would appreciate it, so I'll do it in English. I'll try to do it slowly. If you have questions afterwards, please feel free to post them in Swedish. I'll probably understand the question, and I'm sure that Lars will help me. So thanks for coming and listening to Nuevolution. Nuevolution is a biotech company, and we are based in Copenhagen. I wouldn't say that we are a Danish company. I would say we are a Scandinavian company. We have had Swedish owners since 2004. Actually, the majority of the company has been owned by Swedes since 2004. SEB, Venture Capital, took a significant investment and has supported the company throughout the years and is still a major owner today. We also have Industrifonden, who is an owner, and SEB. And following our IPO, the fact is that the majority of our shareholders are actually Swedish. So I think we are a Scandinavian company based in Copenhagen with labs in Copenhagen, but listed here on the main market in Stockholm and having a good ownership base as a mix of Danes and Swedes. So during the presentation, I will have a couple of forward-looking statements, and as you are aware, being investors, such forward-looking statements are associated with risk, so you should of course be aware of that. So, Nuevolution was founded in 2001 with the idea, the concept that we think we could change the way you do so-called small molecule drug discovery, so identification of tablet-based medicines. That's the idea. We are 48 employees in our labs. Most of these employees are scientists, so PhDs and masters and technicians in chemistry, biology, and computational chemistry. And they work from our labs in Copenhagen. We moved to the main market in June this year, from first having been on the First North premiere for close to 3 years. Then we moved to the main market in June. And we have this very unique platform for drug discovery that I will explain to you. So how do we identify potential new medicines? Our long-term strategy is to build a very broad pipeline of projects that are moving forward in clinical development as well as before clinical development. So many programs that are moving forward to make Nuevolution a valuable company. Hopefully in the very long term we will have products on the market. We focus on diseases in the inflammatory area, so for example autoimmune diseases, we will be talking a little bit about that today, as well as cancer. So in order for you to appreciate what it is we can do with our technology, let me just go quickly through what happens when you do drug discovery. It's all about identifying the one and only approved drug. So that is one molecule, and that comes from a candidate compound that you push through development, test it in humans. Is this safe? Does it do what we are hoping it to do? And does it have the duration of action? Is it acting long enough in the human body? That's what we are testing in the clinical development. But before we get to that, we need to identify this candidate compound. And that's something we do in the research phase, where we are looking at, does it work against the disease target? Does it work in cells, in mice, in rats, and in higher animals? So when we do research, we're looking to see if compounds are active. Do they do what we hope them to do? Are they stable? So do they act long enough in the body of animals and hopefully then later on in humans? And is it safe? Do we have any side effects? So there's a lot of traffic lights that we need to check before we can even think that we have a candidate and before we can prepare for development clinically. So in order to achieve that, all these traffic lights, they need to go green. If we can get to that, then we can nominate a development candidate, and such a development candidate can then be tested in humans. This is difficult. This is not straightforward. And what is happening in the big pharma companies is that they have a collection of test compounds, test substances, molecules that are organized in these microtiter plates. So these are like plastic plates. They are like this size, and then they have a number of wells, so holes. And in each of these holes, you have one test substance. And they have typically 1 to 2 million test substances. And then they have robots that comes and takes all the material, brings it over to a test assay, drop the material, and then they wait some time, and then they will see a readout on a computer, are any of our compounds active? They have about 1 to 2 million test substances where they can do this. And it takes them typically 2 weeks or so to test 1 million compounds. But often they don't find anything. And then the project is just stopped, and they are unable to move forward. And if you think about all these traffic lights that needs to go green, you can imagine that you need to have very good compounds in order to pass through all of this. And you need to test a lot of compounds to actually identify the one and only that can do all of this. And that's what Nuevolution can do. Because instead of testing 1 to 2 million, we are in a completely different game. We have, it's a very big number. You can see it there on the picture. It's 40 trillion in English. It's 40 biljoner in Swedish, 40 biljoner på dansk. So it's a very, very big number. It's much larger than what you have in the pharma companies. And the beauty is that this is actually something that one person can handle. And this means that we can test many more substances, molecules, much more effectively than you can do with conventional techniques, increasing the chance that we will find something, increasing the chance that the compound will be good compound, and that we overall will be successful. So that's the core of Nuevolution's platform. It's something that we have developed over 17 years. It didn't come like this. It's something that has gradually been developed. It took us 7 years to establish the technology, to make it robust and reliable, and then we have refined it for another 10 years to make it a really powerful technology for drug discovery. And we're using that today. And the reason that we can handle all these compounds, whereas the big pharma company, they can't do it because they need to have the robots going in, testing, of course, compounds in parallel, but it's still one by one. It takes 2 weeks to screen 1 million. It would take 2,000 weeks to screen 1 billion. And if you have many billions, it's just mission impossible. You can't scale that technique. So you need to do it in a different manner, and that's what we can do. We are able to synthesize, produce compounds that looks like this. So you can see there's a piece of DNA here, and it's somehow linked to a so-called small molecule. This DNA functions as a barcode. It's like a stregkode. So if you go to the supermarket and you take something down from the shelves and you go to a barcode reader, then it will tell you, you have a bottle in your hand, it's Ramlösa, and here is the price. The same for us. If we isolate one molecule in our screening and we read this DNA sequence, then we can tell what is the structure of this molecule that we have here that is linked to the DNA. So we have mixtures of compounds. So up here we have a library, and this can be millions or hundreds of millions or billions of molecules that are different. They have different structures here and different sequences here. We can then take a droplet, a small droplet from our library. We can add it to a testing system where we have our disease target. This is a protein that maybe cancer cells are very dependent on in order to survive and proliferate. So if we could block that, then maybe we could block the cancer cells from being alive and from dividing. So we take a droplet from our library and we contact it with the disease target, and then we wash away those compounds that do not bind. And after a lot of washing, we end up with those active substances that we are interested in. And then we read the DNA sequences, and then the DNA sequences will tell us what are the active substances. So in this way, we can handle all our compounds as mixtures. One person can do that much more efficiently than you can do with conventional techniques. So that's the basis of what we do at Nuevolution. We work with many different types of disease targets in the inflammatory and the cancer space. We screen more than 10 targets every year, and you see some of the diseases that we are working on, trying to find tablet-based solutions for these diseases. We have collaborations, very large collaborations with Almirall, I will talk about that, in psoriasis, and a very large collaboration with a big biotech pharma company in the US, Amgen, in the cancer space. Partnerships is very important for us. When you have such an effective and efficient platform, it means that you can actually work on many projects in parallel, but it also means that you will produce more than you can mature yourself. It's expensive to do drug discovery in the later stages and moving into clinical development. So of course, we can't move all programs forward ourselves. So we are dependent on partners, and you see some of the partnerships that we have done over the years. In the early years, we did, you could say, service agreements where pharma companies would come to us and we would solve their problems. We don't do that any longer. Today, we focus on our own projects. Once we have found something that we think is really attractive, we go to the pharma companies and we ask, are you interested in licensing this? And then moving that forward. So it's a different business model, and it means that you can add a digit on upfront payments, on milestones, and it's just much more lucrative. So that's what we are doing today, focusing on maturing programs, out-licensing programs. We've done 17 deals today. You will see logos here for many of the bigger players in the pharma industry. We've done deals with all of them, some of them several deals. We've done, for example, 3 deals with Novartis. Today, we are focusing on 3 types of deals. We would like to out-license some of our programs. We have some programs that are getting really mature and ready for that. We would like to enter into further research collaborations where we can get access to targets and skills, and we may actually also contemplate certain types of platform-based agreements. So we have ongoing partnership discussions in all of these fields, and we really hope to close a deal very soon in one of these areas, or potentially several of these. So if we look at the pipeline, and we will not have time today to go into all of these projects, and it's really not the intention. I just want to show you the idea here is to move a lot of programs forward, owned by Nuevolution. As you can see to the right, there are a lot of logos where you see Nuevolution. And then some of them will have a partner logo. So that is a program that has been pushed to a partner, like Almirall, like Amgen, and like Janssen. So for us, it's also a business strategy to reduce our risk. So if we can move many projects forward, we can also afford to fail. We don't need to be successful in each project. It's okay if we fail in some projects. So that's the idea, and the projects we have here fall within autoimmune diseases and cancer. If you read our quarterly report that we released yesterday, you will be able to read much more in detail about these programs, and I will not go into it today, but this is a copy of the slide that we used yesterday. So we are seeing good progress across a wide range of different projects. I would like to just touch on 2 of the programs we have, or the 3 of the programs we have, 2 of them within a specific pathway, a disease pathway. So, whoops, go back again. So these Th17 cells, these are T helper cells. Type 17 is the name of these. They are very active in a number of autoimmune diseases, like psoriasis, like another a rheumatoid arthritis type of disease, like ankylosing spondylitis, potentially in IBD, inflammation in the intestines, and a number of other diseases. These T helper cells can become overactive, so too active. And if they do that, then they will release this IL-17 molecule, and that would signal to the rest of the immune system, come to this place where I am, we need to have an inflammatory process going. And of course, that's not the idea. You don't want it, being the patient, but the immune system believes that this is what is needed right now. Today, we actually have a very good treatment. We have antibodies that can eliminate, so inhibit this IL-17A, as well as this IL-23. That's used in psoriasis, that's used in ankylosing spondylitis. but the price is horrendous. Today it will cost 12,000 Swedish kronor every month to get an injection. So very expensive treatment. It works, that's a good thing. So the mechanism of action is fully proven, but you need to have an injection, and it's very costly for the authorities. And then on top of that, your immune system, this part of your immune system is extremely effectively suppressed. So this means that the immune system is not available if you get an infection where normally the T helper cell 17 would be active, then you cannot deal with that. So that would mean you would need to be hospitalized. So how can you improve this? Well, if you could get a tablet, that would mean that you don't have to have the injection, of course. It would also mean that the half-life would be much shorter. Instead of having a half-life of 1 month, which is the case with the antibodies, you would have a half-life of 4, 8, 12 hours. This means that if you get an infection, stop taking your medicine, and then it gets out of your body. So a tablet is much more attractive, and also the cost of producing tablets, these types of molecules, is much cheaper. So it should be cheaper medicines that could be offered. We have 2 approaches for addressing this pathway, and one is to inhibit these naive cells that normally develop when they are stimulated into these active cells, and we can do that with inhibiting this specific target. It's called ROR gamma T. Let's not go into what that means, but it means that this cell is dependent on that in order to become these active cells. So that's one way of blocking this process. Another way of blocking it is, what if we could have a small molecule, so something that could be put into a tablet that can do the same as the antibody? We have such 2 projects where we have exactly that. And one of the projects is the ROR gamma project. That's one that we have in collaboration with Almirall. Who's Almirall? Almirall is a major player in the dermatology space. They are top 3 in Europe and top 6 in the US. They have their headquarters in Barcelona, in Spain, around close to 1,800 employees, and they have presence in 17 countries. This is a perfect partner for us because they have dermatology as their specialty interest. We received more than 100 million Swedish kronor in upfront, as you can see here, when we signed the agreement. And we have development and sales milestones that are significant, plus royalties on future sales. So we are very happy with this partnership. So we have a very dedicated partner here. In the other project that I mentioned, the IL-17, where we are trying to mimic the antibodies, we have just recently shown that our compounds are as good as antibodies. So what you see here to the far right is an antibody, IL-17. We are in mice. This is not human studies. This is a mouse study. And it's a mouse study where you mimic psoriasis. So you put on a certain type of cream that will induce psoriasis symptoms on the back of mice. And you can then treat them with an antibody that you inject, or you can treat them with the Nuevolution compounds, Nuevolution compound 1, 2, or 3. And as you can see, if you have the sick animals, you see the red one here is very high, and if you use the antibody, the blue one, you can suppress that. If you use our compound given as an application on top of the skin, then we can achieve exact same thing. So for us, this is attractive. This means that instead of having an injection, you can maybe have a cream available. And of course, going forward, we would also like to further develop into having a tablet-based solution for the more severe cases. But if it's not so severe, it's much nicer to use a cream, of course, than to get an injection and have your immune system completely suppressed. This is a bit busy slide, but just to mention another project that we are working on. Here we are working in a target area where we can affect the genes that are expressed. So which genes are active? When you have an inflammatory process or when you have cancer, a lot of genes will become active for cancer cells because they need to divide, and for immune system cells because they need to produce a lot of substances, a lot of proteins to keep the inflammatory process running. So can you inhibit that? And that's what we've done in this project, where we have something called bromodomain inhibitors. We are able to inhibit specific targets that regulate which genes should become active. And we have unique substances here that are very selective, and this allows us to have very good safety. And we've also shown that we only affect a very few sets of genes, and you will not be familiar with this, but if you Google some of these acronyms you see to the right, you will see that these are genes that are involved in fibrotic diseases, for example. So for example, if you have a solid tumor, what the tumor would like to do is to protect itself. So it will create a fibrotic network around it, such that substances, immune system cells cannot attack it. Then it's protected. And we can't treat the cancer, it will just grow inside. That's a solid tumor. If you can inhibit formation of this fibrotic condition, then you can attack the cancer. So having substances that can reduce the fibrotic process is really attractive, as well as, of course, inhibiting fibrotic diseases like, for example, fibrotic lung diseases and a number of other liver fibrotic diseases, and etc. So that's what we have here, and we expect to have the development candidate before Christmas. That's the plan. So this is a program Nuevolution has developed from ideas on paper and all the way up to candidate. We have a lot of animal data that supports that. We have the traffic lights going all green. And then finally, I would like to just talk about our collaboration with Amgen. The collaboration with Amgen is a research collaboration. It's a multi-target collaboration, so Amgen and Nuevolution decides together to work on a number of different disease targets, especially within cancer. Nuevolution will do some of its work, and Amgen will then come on board later on. If Amgen decides to license our programs, then you can see the payments here. We will get a licensing fee up to or more than 90 million Swedish kronor at licensing, and we will get a significant payment package afterwards. Who is Amgen? Well, this is really one of the top players, certainly in the cancer space, but also in general. It's a top 7 US company in the pharma space, top 12 in the world, size-wise like AstraZeneca, so this is a big company. They are present in more than 100 countries, and they focus on cancer. So again, a very perfect partner for Nuevolution. And this is the structure of the agreement. Nuevolution takes the early risk. We screen, we show that it works in animals, and once we've done that, then Amgen can decide we like the program, we would like to get on board. Then they use an opt-in right, and once they do that, then they will pay all the further cost of the development of the program. And Amgen has so far done so in 2 programs. So just yesterday, the day before yesterday, Amgen decided to opt into its second program. So we have 2 programs that are moving forward together with Amgen, where they are financing everything. And then we have a number of programs where Nuevolution is still alone and trying to get to proof of concept in animals. Should Amgen decide to license, you can see the numbers here again, and they can decide to license the program up to end of phase 1. So when we have tested in healthy volunteers, they can decide to license the program for these terms, and the licensing fee will increase the longer they wait. So what have we done as a company since we IPO'd the company? We IPO'd the company in 2015. We raised a significant amount of capital, 250 million Swedish kronor at the time, to really push forward the pipeline with the intention to enter into partnerships. That led to the partnership you have here with that I have talked about with Amgen and Almirall. At the same time, we have had a collaboration with Janssen, and they have now taken license to one of the programs, and you can see that they have also been paying about $2 million so far, and will hopefully pay more going forward. We have had a technology transfer agreement with Novartis. They paid certain success fees here up to $2 million. We have progressed the pipeline such that we are getting very close to clinical development. Technology-wise, we now have the biggest collection of molecules for testing that exists on Earth. This is not just bragging, it's actually a fact. It's the biggest test collection that exists. And in May, we expanded the shareholder base. We got in additional capital to further mature the programs and further expand our activities. We moved to the main market in June. We have a strong cash position today, so 130 million Swedish kronor as of September 30th of September. And then 2 days ago, Amgen decided to opt into its second program, so we have 2 check marks there. Finally, here is the forward-looking statement. So what we are hoping to do, of course, going forward is to report more from our collaboration with Almiral, our collaboration with Amgen. We expect to enter into a new partnership, and then, of course, progress our own pipeline. And if you wish to learn more about Nuevolution, you can see our CBO here, Ton Berkien. He was the cover person of our quarterly report from yesterday. Go in there and read more about our activities. And also there's a video report, live sending from yesterday. If you go to Red Eye's site, you will have the Q3 report as a video, and you can access additional information about Nuevolution on our website at nuevolution.com. Thank you. Lars?
Thank you, Alex. Fantastic. I have a simple brain. I have to get my head around this.
Shoot.
Let's say I have a smaller drug company, like we had the company Cancera here this winter. They have a couple of molecules. They hope to be able to develop a treatment for some sorts of cancer, of course. So they can go phase 1, that would be a toxology study to make sure you don't lose your teeth and get green hair and die from it treatment. And they have like a 70% chance of surviving phase 1. Probably in that case, they're through phase 1, but this for an example. So they have a 70% chance, and they maybe, if they do it themselves, they will need to burn like 3 million euros on the tox study.
It depends on how they have decided.
2, 3, 4.
Probably 5 to 8 or something like that in dollars.
And then you have phase 2 to show treatment results. There you would burn like 20 million euro. You have a 70% failure rate. So then you have the combined 0.5 times 0.3, you're down to 15%, and you have phase 3 before you go to market. So you have like this would be typical 1, 2, 3, 90% failure rate, and going through the stages is a must, and you will have used like 30 to 40 million euros. Now let's say I take my molecules and I come to you. How much would I pay for the same cycle if I partner up with Nuevolution?
So it would be very different, because Cancera should, of course, if they believe they have already...
Let's use a generic example.
But Cancera or another company, a company has already identified a development candidate, and they believe the compound is good enough. Then they should just move forward. They don't need us. They have identified the one and only. So they don't need us. If they want to have a backup compound, then of course they could come to us. If they did not have the one and only development candidate, they could come to us. But if they have already identified it, they have already selected it, they don't need us. Then they should just move forward if they believe the compound is good enough. What we could offer if we are involved in the project, of course, is that we are able to identify the candidate compound plus backup compounds very fast at a lower cost for the research and faster, and also hopefully produce better compounds such that your chances of being successful in the difficult clinical development increases. So that would be the idea. The other thing, now you're mentioning the attrition rates, the risk. So from starting the clinical studies all the way to the market, I mean, we're talking about 8-9% chance of being successful overall. And that's something, of course, Nuevolution has taken into account also, because if we move a lot of programs forward, and each of them would have, say, 8, 9, 10, whatever % chance of being successful, then overall the chance that one of them will be successful, of course, increases. That's the business model. So having more programs, that increases our chances of being successful. And the generic company that you talked about that would have already identified its candidate compound, they would need to finance, as you also talk about, all the steps forward. They have the one and only...
We know in this room, trust me.
Yeah, they have the one and only compound. If they fail, the company fails. That's not the idea with Nuevolution. The idea with Nuevolution is if a project fails, well, then there's other projects that could succeed.
Question from the audience? Thought you would have a question.
He knows us too well.
Okay, so I will get more treatment prospects, but I still have to finance the phase 1, 2, 3. Is that the deal?
You will always need to finance the phase 1, 2, and 3.
Yeah.
But the idea, that's why I had the partnering slide, that we're producing, you could say, too many projects. That's a luxury situation, right?
Yes.
So that means that we can actually partner some of them and then have these projects developed by a partner. The generic company that you're talking about would probably also need a partner. It's not likely that they would be able to undertake the phase 3 study. So they would need a partner somewhere. And that's the same for Nuevolution. We just have more options for the partnering.
Yes. Okay. So is then your main task for 2019 or for the next 3 years, is that to be more well-known within big pharma, universities, or where does your efforts go?
I think we are extremely well known in the pharma industry. Everyone knows us. As I showed, we have 17 deals, and it's all the big players that we have been working with. So they know us very well. Academia knows us. We get people approaching us every month asking if we could undertake a certain project. So we have a lot of attention in that. So that's not the focus. The focus for 2019 is definitely to move the projects forward such that we get closer to or potentially into clinical development. That's the key. And then, of course, from a business point of view, we want to close the partnership discussions that we have ongoing.
Okay. So we take one question from the audience here.
Absolutely.
Just a little bit elaboration about the last thing. The focus and priority of 2019, is it to develop your own compounds, or is it to try to get more collaborations with big players?
Both, because we have 10 plus projects that are running, and these of course are owned and controlled by us, financed by us, so they will move forward. But we need partners, and that's why we have so much focus on the partnering. So we definitely would like to enter into partnerships also in 2019 or 2018.
Yes, so you're a new company, new technology. It sounds fantastic. Growth rate is not that high, though. I looked at your very new Q3 report, 2018 versus 2017. You're doing about a 10% growth in revenue and still have a burn rate. What's in the cards for you for coming years? So do you have like a break-even year target, or?
Being a biotech company, it's a very different. It's a unique business model or industry as such. I mean, it's an industry where you invest a significant sum of capital, potentially over many years, with a huge upside. So in that sense, it's very different from other industries, and that doesn't just go for us, it goes for all biotech companies that try to develop medicines. So in terms of revenue stream, it will come in chunks. Just as it's done in the past. There will be years where we may have black numbers, we've had that. There will be years where we have a loss. The overall concept is really to build up a broad portfolio of assets that will increase the overall value of the company. And that's the way you do it in biotech. So it's a long-term ride in that sense. And on the way, hopefully the market will recognize and appreciate the value built. But there will be a number of loss-making years, just as there are in other biotech companies. But of course, the revenues that comes in, which is unique for us, I believe, is something that we can reinvest. So it's a hybrid business model as such.
Do you also have a hurdle with the pharma partners, your potential customers, that they want to keep the project proprietary and they don't want to share anything with you? Do you have a trust issue, or is that not the big case?
No, it's very, I would say it's very standard. When you have a pharma company that comes to you and they would like to license something that you have produced, it's normally very clean and very clear. They want to own everything for anything. So it's very easy. And then it's more a matter of what are the financials for that. So there's nothing to be discussed, really. So you'll get the upfront payment, you'll get milestones, and you'll get royalties. And then it's for you to decide, do I really want to hand over my baby to you? Because I am dependent now on you actually developing it.
Yeah.
And that balance is the important one. So when do you feel that the numbers, the financial numbers, compensate you enough to make you think, well, I can get rid of the risk, I have a significant upside, and I feel it's fair when I hand it over to you. So I think that's a standard model in the industry. The pharma companies, they have a very clear opinion about what they want.
Okay. Thank you,
Thank you.
Alex and Nuevolution.
Thank you.